Welcome, friends, to another opportunity to learn and connect with your pelvic floor muscles. My name is Jeanice Mitchell, and I'm a pelvic health physical therapist. And today we're going to be discussing how to train your pelvic floor muscles to pee or urinate when and where you choose. So before we get started, just a reminder here, let me start my screen. I am a physical therapist, but I'm not your physical therapist. This is information for you to increase your awareness of your body, but it's not medical advice for you. And always check with your healthcare provider first if you're pregnant or think you have an infection. These are red flags that if you have any of these, I definitely encourage you to get checked out. So unexplained bleeding or pain, trauma, fever, chills, night sweats, unexplained weight loss or gain, altered mental status, and depression or suicidal thoughts. Especially this month, May, is Maternal Health Awareness Month. And so the mental health component of pelvic health is huge. And we certainly want to make sure that that is included in an overall body health program. All right, so the two main things that we see, this two primary categories of issues that we see with the bladder are, number one, leaks. And there's a lot of different kinds of leaks. And so today we're going to be going over primarily leaks with exercise and leaks with activity, but we'll touch on a little bit of the other types of leaks. And then there's the opposite side where people have difficulty emptying their bladder. So they may have to strain or push. It may be painful. They may feel like they have completely emptied and they didn't. Sometimes even frequent urinary tract infections can happen if there's residual urine left in the bladder. And so the pelvic floor muscles, as you can see here in this anatomy diagram, we have the bladder. It's kind of like a water balloon. And then the bladder itself is surrounded by a muscle called the detrusor. And this is an involuntary muscle, which means you can't tell your detrusor to squeeze, and it squeezes. And the job of the detrusor is actually to push urine out of the body. And I think, sometimes people think, oh, I need to push to empty my bladder. That is not the good bladder habit. So the detrusor, again, is an involuntary muscle. And then here's the outlet where urine exits. And this is the urethral canal. And then you can see the pelvic floor muscles that wrap around that urethral canal. And the pelvic floor muscles are voluntary, which means they should do what we tell them to do. We can train and strengthen them. And so the ideal mechanics here would be the bladder fills up, and as it's filling, the pelvic floor muscles are staying tight and closed, right? They're engaged to keep that urethra closed. And then when it's time to urinate, the pelvic floor muscles relax and this detrusor muscle squeezes. But again, that's not a contraction that you can feel, and that's not a contraction that you have any control over. So do not walk away from this thinking, oh, I need to squeeze to push my urine out. Absolutely not. So again, here's the pelvic floor muscles, and that's the role of the basic role of the pelvic floor and the detrusor in emptying. Here is another view of anatomy. So we have the female from the bottom view. We're standing at the feet looking into the perineum. This is the pubic bone, that's the tailbone. Here's the anus, where solid waste, liquid waste, and gas come out, the vaginal opening, and then the urethral opening. That's the clitoris. And then you have pelvic floor muscles that go front to back and side to side. Here is an animation watching, and I really want you to watch that little yellow spot there, okay? So watch what happens there when those pelvic floor muscles squeeze, that urethra kind of closes off, closes that opening. when we talk about pelvic floor muscle training towards the end of this workshop today, it's important to remember all of these different muscles. So some people, you know, are really, really good at squeezing the muscles around the anal sphincter, but maybe not as good about squeezing the muscles up around the urethra. And so understanding that you have multiple muscles, multiple layers, multiple jobs, and they have different jobs to do. So as you can imagine, the muscles that are surrounding the anus here are going to be closing off that anus, right? Versus the muscles here. Look here, these actually connect and attach there to the clitoris. And so these pelvic floor muscles help with orgasm and help with clitoral erection. So it's really cool how our pelvic floor muscles are designed and function. So here is another view. And we have the pelvic floor muscles that are now relaxing to allow those openings to open. And so this would be when you're like on the toilet, right? So when you're on the toilet, we want those structures to relax and lengthen and soften, those openings to kind of open, and the pelvic floor muscles to just kind of relax. On the toilet is not the place where you want to be practicing Kegels. Occasionally identifying the pelvic floor muscles on the toilet is okay, but not as a form of exercise and not doing it regularly. All right, so now I'm going to stop the screen share for a little bit. Urinary leakage can have a huge impact on quality of life. So it can, you know, impact how well we interact, what our activities are. Jumping can be difficult. We might be wearing black pants when we exercise because of leakage, being afraid of sneezing because, you know, leaks come out, laughing, social events. And then sometimes we think about like these big events like jumping, sneezing, running, like those things can cause leakage, yes, but also smaller increases in the intra-abdominal pressure can cause leakage. I'm going to do a messy experiment here. So let me move my keyboard out of the way. And we have a bladder, okay? So this is a full bladder, and here are the pelvic floor muscles that wrap around the urethra. And these pelvic floor muscles need to counteract the forces on the bladder. So that would be intra-abdominal pressure. That's what we call it. Basically, anything we do does involve intra-abdominal pressure. Even talking, like if you put your hand on your belly and you can feel your abdominal muscles engaged a little bit, that's intra-abdominal pressure. So as you can imagine, a huge increase in intra-abdominal pressure, like we're jumping, right? Woo! That bladder's going up and down, and those pelvic floor muscles really have to activate. And if they don't, if they're not able to counteract the force from that activity, then you can have leakage. You can have a little bit of leakage, or you can have a lot of leakage, right? So again, I think a lot of people are familiar that this happens with those big increases in intra-abdominal pressure, but sometimes this can happen with small increases in intra-abdominal pressure. So a small cough, or even rolling over in bed, or going from sitting to standing. And I especially see this more in my senior population, that the muscles may have atrophied some with age, and they just don't have that bulk and that strength and that coordination to counteract the force. And so that's why it's important, even if you're not having leakage at this point, to bulk up those pelvic floor muscles and strengthen them and work on coordination, so that when you have increases in pressure, that you don't have leakage. So I'm going to actually just let this water out so it's not worrying me here. All right, so you understand that you can have small amounts of leaks or big leaks, and then a range of activities can cause those leaks. Now, why do leaks happen? So they can happen because of a variety of reasons. Pregnancy and childbirth play very significant roles. Vaginal childbirth can cause severe injury to the pelvic floor muscles and surrounding structures and could be considered equal to a major sports injury. Let's just pause for a moment there. I'm going to say that one more time. And if you're seeing my Instagram account right now, you know, I'm doing this whole series on perineal tears, 3rd and 4th degree perineal tears. So let's repeat this. Vaginal childbirth can cause severe injury to the pelvic floor muscles and surrounding structures and could be considered equal to a major sports injury. So if you had an ACL, like a ligament tear or a ligament rupture in your knee, a lot of times they're going to do surgery, and almost always you're going to get rehab, sometimes before and certainly after. Wouldn't it be wonderful if rehab of the pelvic floor was incorporated into pregnancy and postpartum, and understanding the role that the pelvic floor muscles have on pelvic health? So that's utopia, but that is what I'm here for, and you're here for it too. So I'm really happy that you've joined me, and I hope that you'll share this with other people. So after this damage, the pelvic floor muscles are rarely given the time or attention needed for a full recovery. Getting older also increases the risk of leakage. As we age, our voluntary muscles slowly lose their strength, size, and tone. And then there's other factors like obesity, constipation and straining, prostate surgery, hormonal changes around menopause, a hysterectomy, type 2 diabetes, and smoking are among the many other factors that can increase the risk of stress urinary incontinence. All right, so why does it matter? Like, hey, so what if I leak a little bit? Let's just put on a panty liner and live life, right? Don't worry about it. You only live once, YOLO. No, okay, so basically, urinary leakage is a warning sign from your body. So it's a sign that the pelvic floor muscles lack the strength or coordination to close off that urine exit canal. Urine leakage should not occur with activity or exercise. So that's not how our bodies are designed to function. Urine leaking can be embarrassing, irritating, and expensive. And then over time, a panty liner may progress to a mini pad may progress to a maxi pad may progress to supportive underwear, and then supportive underwear may progress eventually to full diapers. And that's what we're seeing like in the nursing homes, right? So there's a huge rate of urinary leakage and bowel leakage in the nursing homes. And that can have a huge impact on their quality of life. And a lot of times that's why people are even getting put in the nursing home in the first place, because their families, you know, don't want to care for that or don't have the resources and tools to care for that. So sadly, many people worldwide must endure the embarrassment and discomfort of urine leakage, pads, and diapers. Now, we are going to touch on this in a little bit, because here I am, I'm talking about pelvic floor muscle training, I'm talking about pelvic floor physical therapy, but it is not a 100% cure. So it's possible that you do everything right and you still have some leakage. And does that mean that it's wrong to exercise, or that it's wrong to put on a pad or a liner or do what you need to do? Absolutely not. And I certainly don't want you to walk away from this feeling ashamed. I want to empower you with knowledge and tools and resources here to help you live a dry, confident life. But if you aren't 100% dry, that doesn't mean that you're a bad person or that you've done anything bad. Okay. So let's move on. You're not alone. So this is called stress urinary incontinence. So where there's stress on that bladder and those pelvic floor muscles, stress on the bladder and the pelvic floor muscles don't have the strength, coordination, or support to counteract that stress. Another type of leakage is urge urinary incontinence. And so that's the kind of leakage that might happen, like if you put the key in the door and you're like, all of a sudden urine is running down your leg. So that's called urge urinary incontinence, and that can be a whole nother topic and a whole nother webinar. Also, you know, we talked a little bit at the beginning about the incomplete emptying part and about straining and about the need for those pelvic floor muscles to relax and lengthen so that the openings open so urine can flow out. That again can be a whole nother webinar. So today we're focusing on leaks that happen as a result of exercise or activity. But at the end, we're going to have a Q&A. And so if you have any other questions, feel free to ask them. All right, so stress urinary incontinence is one of the most common urinary conditions for which female bodies seek help. So up to 35% of older women. So in these studies, they're not using that gender inclusive language. So in the studies, it has women, but you know, you can replace vagina owner, female bodies for that term. And women, that's a great term too. So, you know, we'll focus on this, but if I want you to know that everyone is welcome here, okay? And just because some of the older research doesn't have that gender inclusive language doesn't mean it's not good research. So up to 35% of older women struggle with stress urinary incontinence. Some girls and young women also struggle with leakage during activities like recess, PE, and even laughing. I'm going to give you an example here. So I was a pelvic floor physical therapist. I went to training shortly after the birth of my first son in 1999. And so I had been a pelvic health physical therapist probably 5 or 6 years, and I went to a pediatric pelvic floor class, a pelvic floor training class. And I came home and I asked my daughter, I was like, hey, are you having any urine leakage? You know, like if you're out on the playground, does any pee-pee leak out? And she's like, oh yes, mommy, a little bit. You know, and that wasn't something that I had ever even thought to have a discussion with my young daughter about. So it can happen across the age range. The youngest person that I've worked with has been 5 with urinary leaks, and she didn't come in with that concern. She came in with bedwetting, and then we figured out she was also having leaks during the day. And then the oldest person that I've worked with has been 94. So as long as that person has the cognitive function and the will to do this pelvic floor muscle training and the other things that pelvic PT works on, then there can be a lot of times fantastic results. So, all right, but I think that there's this stigma that it's only people in the nursing home, it's only people as they age that have leaks, and it's not true. It happens across the age range. So a study from 1994, more than 25% of female college athletes who have never given birth had urine leakage during sports. So imagine that, 25%. And then we have nearly 1/3 of female volleyball players, and up to 80% of female trampoline gymnasts also have urine leakage. Urine leakage even impacts those serving in the military. Over 50% of women experience urine leakage during pregnancy. And while it's common to have leakage immediately after childbirth, it's not normal for it to continue. So I want to point out here, because so let's say you had a vaginal delivery and you have a little bit of urine leakage that comes out for a few weeks. You know, is that a huge warning sign? No. So transient urine leakage is to be expected, and it's part of the process. You just had a vaginal delivery, and so those muscles are really stretched out. But it's when that urine leaks continue and persist. So generally we'll say, like at the 6-week check, if you're still having urine leaks, talk to your doctor, or if there's such large urine leaks too. So, all right. 76% of women with urine leakage 3 months after giving birth still have urine leakage 12 years later. That's a really high statistic. The resultant damaging effects of childbirth on the pelvic floor also contribute to stress urinary incontinence. So per the International Continence Society, it is estimated that pelvic organ prolapse is associated with stress urinary incontinence in 40% of cases. Pelvic organ prolapse, and we're going to talk more about this in our 5th session, is the descent or falling of the bladder, uterus, or rectum. Men can also have urinary leakage, especially those who had prostate surgery, trauma, have a neurological disorder, or may struggle with coordination. Okay, so this sounds really daunting, right? Like, oh, all these people have urinary leakage, and how discouraging that it's way more prevalent. But I think it actually is affirming to know that you're not alone, and that a lot of people do struggle with this. A lot of people aren't talking about it though. So with healthy pelvic floor muscles for life, you can train your pelvic floor muscles to do the right thing at the right time. So just like other muscles can get bigger, stronger, firmer, and more coordinated with proper training, so can your pelvic floor muscles. And just like we can train ourselves to cover our cough, we can also train ourselves to squeeze and sneeze. So some of you may have been around when we used to actually cover our cough with our hand, right? Or sneeze. So like if we had to cough or we had to sneeze, we would cover it with our hand. Over, I don't know, maybe 5 or 10 or 15 years ago, instead of with the hand, it's kind of been replaced with the elbow. And now, especially in COVID, I think we all just feel guilty if we have to cough or sneeze when someone's around, and we try to certainly use this and go the other direction and get away from people. But my point here is that we trained our bodies to go from this to this. And when you have a child and you're training them, okay, when they're sneezing, make sure you cover. Instead of this, we're covering here. And so the principle here is that when you're about to cough or when you're about to sneeze, we want to train those pelvic floor muscles to activate, to counteract that force from above, from that cough or sneeze. And that's called a NAC, or a pelvic brace. So research shows that practicing a pelvic floor squeeze while coughing or sneezing can reduce urine leakage in as quickly as 1 week. This alone can improve leakage with an average cough by 98%. So just that coordination piece is huge. So maybe it's not even a strength issue in some people. Maybe it's a coordination issue, and those pelvic floor muscles aren't automatically engaging like we want them to, and so they need to be trained to be engaged. Pelvic floor muscle training is the #1 recommended intervention for stress urinary incontinence by both the International Continence Society and the American College of Physicians. Pelvic floor muscle training has shown up to a 73% cure rate and up to a 90% improvement rate in stress urinary incontinence. There's also strong evidence that supervised pelvic floor muscle training during pregnancy lessens urine leakage the first year after giving birth. So I think this is a really good example of where, okay, you can try doing a Kegel, but having someone that is skilled and an expert in the pelvic floor help teach you and train you with your pelvic floor muscles in a pelvic floor muscle training program is far more effective than trying to do it on your own at home. I like to equate it like to a haircut. So can you do a haircut at home? Well, sure, you can do a haircut. Will it turn out the way you want it to? You know, that's debatable. So going to someone that has skill and training, your results are more likely to be effective. And you're more likely to be pleased with the outcomes. So pelvic floor muscle training can also help men regain control sooner after prostate surgery. Unfortunately, studies show that many people perform pelvic floor muscle contractions incorrectly. Straining, so a lot of times people, so remember, when we squeeze, we want to close those openings and lift, but a lot of times people are actually pushing down. So straining instead of contracting can stretch the muscles and supporting connective tissue, weakening their ability to contract and potentially making urine leakage worse. So during pelvic floor muscle training, and I'm going to give you a sample program here at the end. So during pelvic floor muscle training, skilled pelvic physical therapists help you learn how to control your pelvic floor muscles to correctly squeeze, completely let go, be active at the right times, and be relaxed at the right times. So based on that evaluation that your pelvic floor physical therapist does, will help to select the correct starting position, and then will advance you to more difficult positions and activities as you're able. We also use a lot of different interventions in pelvic floor muscle training. So we can use different tools like biofeedback and vaginal weights and real-time ultrasound and pelvic wands. I mean, the list goes on. And this is really, I think, a rapidly growing industry that a lot of people are trying to capitalize on. And there can be a lot of effective tools out there, but the tools are only as effective as how you use them, right? So just like anything in life, if you're not using it correctly, then it won't be that effective. So there isn't like a magic pill or a magic device that's just gonna, bam, make everything better. It's gonna take work, but it is a very very solid intervention and has helped a lot of people. Okay, so if you could reduce or eliminate leakage with exercise or activity, wouldn't it be worth just a few minutes every day to do that? Pelvic floor muscle training improves confidence and saves money and natural resources by focusing on the cause of the leaks. It also can reduce or eliminate costly pad purchases, surgeries, and embarrassing accidents. All right, so I have another slide here to share with you. All right, so now how to stay dry. So there's 6 categories here that we're going to talk about. So number 1 is reducing or eliminating risk factors that you can control. So if you remember, some of those risk factors were like pregnancy or postpartum or menopause. Well, some of these things, just are part of life, and that's not something that we reduce or eliminate, unfortunately. Can you give me a pill, please, to reduce or eliminate menopause? We would all be billionaires if that could happen. So reduce or eliminate the risk factors that you can control. So smoking, make a choice not to smoke. Smoking doubles the risk of urinary incontinence. Maintain a healthy weight and normal body mass index. So if you're overweight, even losing just 5 to 10% of your body weight can significantly reduce urine leakage. Avoid constipation and straining where you're pushing down on the pelvic floor muscles. If you have diabetes, work with your doctor to stay in control of your health. Now, the next one is healthy bladder habits. So a lot of times we learn our bladder habits from our parents, and they're just kind of with us for life. And that's what we think we're doing the right thing, but you may not be. And especially in our busy, fast-paced life, we're trying to go, do everything, right? The habits that we develop may not be the best habits. So let's go over some of the key foundations to healthy bladder habits. When urinating, relax, take your time, and avoid straining. Ideally, let your urine flow out in one solid, steady stream. So sometimes, I don't know if you've ever been in a public restroom and somebody is urinating next to you and you hear like, like it's a start flow, or just a little baby trickle that goes on forever and ever and ever. So there's probably some kind of pelvic floor muscle dysfunction happening with those types of urine streams. We want a solid, steady stream. Avoid urinating just in case. So this kind of looks like, okay, I'm about to go to the grocery store. I don't really need to go to the bathroom, but I'm going to go just in case. Or, ooh, I'm at Target and I'm shopping. I don't really need to go, but there's a bathroom there and I'm going to go just in case I have to go later. So occasionally going just in case isn't a big deal, but it's when these become a habit. I've worked with people that have been urinating. They've been on the toilet like every 15 or 20 minutes, like throughout the day. What kind of life is that? Like you're in the toilet easily 3 times an hour. How can you get anything done? So that's just a very poor quality of life. And so let's just keep going. Urinate at your convenience instead of rushing to the bathroom. So when you feel that urge, you want to do some techniques to help quiet that urge and then calmly walk to the bathroom. Urinate every 2 to 4 hours during the day, and then ideally sleep through the night unless you're pregnant or over 65. So if you're pregnant or over 65, then that increases up to 2 times a night. But again, I've had patients that have been going to the bathroom 8 to 10 times a night, sometimes even more. Like, what kind of quality of sleep are they getting at that level? And so the bladder has little signals. And so remember, it's kind of like that water balloon. So as it fills, it expands. And your bladder can actually be trained to to, as even if you just have a few drops of urine, those little sensors in your bladder may be overactive and sending messages to your brain saying, hey, I've got to go, I've got to go. And then, you know, this creates this really bad cycle. So that's where the just in case peeing can actually set you up for some bad habits later on. Stay hydrated so your urine is healthy and not concentrated. That's another one that I see a lot. Okay, I'm not going to drink because I'm afraid that's going to make me need to urinate. But a lot of times that concentrated urine can actually be irritating to the bladder and cause that bladder to want to spasm, the bladder, the detrusor muscle, and push the urine out, which is not what we want. We want to control so that when we are on the toilet, we can choose when and where we urinate. All right, so that was healthy bladder habits. Now let's jump into pelvic floor muscle training. So these are the key foundations here for pelvic floor muscle training. Identify. There's a lot of different ways that you can identify the pelvic floor muscles, but I think one of the easiest ways is to put your finger on the outside of your anus or use a mirror and watch your anus squeeze. So when you squeeze, those pelvic floor muscles should, that anus should pucker up and in. If you're looking at it or you're feeling it, and when you squeeze, that anus kind of softens and drops into your finger and goes out, that means you're going the wrong direction. All right. So number one, first, finding the pelvic floor muscles and practicing squeezing the anus is one of the easiest ways to do it. Once you find the pelvic floor muscles, practice isolating without squeezing your buttocks, legs, or holding your breath. No one should be able to tell if you're squeezing, if you're isolating. So like right now, I'm squeezing, you have no idea other than I just told you, although you can't really see my bottom or my hips, but I'm not cheating. So isolate. Now, once you have identified the muscles and you're isolating and you're not using any of those cheater muscles, we want to work to improve. And specifically for urine leakage, we're really wanting to squeeze front to back and close all those openings. So like I touched on just at the beginning a bit, if you're only working on squeezing those external anal sphincter, you know, and closing the anus, you may be missing out on really helping to train some of the anterior, the front part of the pelvic floor muscles. And this can be really tricky. We work a lot on this in therapy, you know, helping people to discriminate between the different muscles and help to train the right muscles. Sometimes I think it helps, like if you're, if you can see me here, I'm going to stop sharing my screen. So if you stand up and like if you, here I am from the side. So if you're kind of tilting this way, you're more likely to get those posterior fibers towards the anus. But I think sometimes kind of tilting your pelvis anterior, and especially if you're sitting on something, can help. Also sitting, like get a rolled up towel and put it in between your knees and sit on it. Sometimes the proprioception from that tactile input can help. So let's go back to sharing the screen. I'm getting better at this, you guys. Woohoo! All right, so squeeze front to back and close all the openings. And when you're squeezing, you're working on squeezing the openings and lifting the pelvic floor, kind of like a basket that you're lifting up. Okay, I will get to I'll do the Q&A at the end here. We're close to the end. My target is 20 to 30 minutes for these presentations, but I have so much, and I'm trying to go fast, but there's just a lot to talk about. And so I thank you for still sticking around here, you guys. All right, so improve, squeeze front to back and close all the openings. And then I like to start off, and this is what a really prominent researcher has shown to be very effective, a very effective pelvic floor muscle training program, is to do this in 3 positions. So start off lying down, like lying flat on your back or with your knees bent. hold that contraction, a strong contraction, like a maximum voluntary contraction, and then rest. Depending on where you are, again, this isn't medical advice for you. So ideally, I'd like to get my patients to the point where they can squeeze that maximum contraction. They can hold it 10 seconds. So they have a 10-second contraction, and then they rest for 10 seconds. And then they do that 10 repetitions lying down, 10 repetitions in sitting, and then 10 repetitions in standing. But if you're just starting off, or you may not be getting a great contraction, decreasing the seconds that you hold, decreasing the endurance, you'll just need to back off and then build up. Also keep in mind that pelvic floor muscle training shouldn't be painful. You shouldn't have any symptoms. So if you are having pain or difficulty on the toilet or difficulty emptying afterwards, make sure that you don't try to just DIY this. Go get someone to help. And a lot of things can be helped virtually too. So even if you don't live in an area where you have a pelvic floor physical therapist, or you don't want to go see one in person for whatever reason, there's a lot of cool things that can be done virtually. All right, so now we did the 3 positions with 10 reps in each position. Then do 10 quick squeezes. So that's where you just squeeze, release. But again, you're making a good strong contraction, and you're focusing on releasing here too. So it's not just the contraction. We also want the muscles to let go. And generally, I recommend to do this at least 4 times a week. And then we add in a lot of other exercises and functional things too. So that's where we go to integrate before an activity, pre-contract the pelvic floor muscles. So squeeze and sneeze is an easy way to remember this. And that example would be, let's say, every time you lift up the baby, you leak a little bit. Okay, we'll start practicing squeezing and then lifting the baby. And if you haven't seen my video on pelvic brace, make sure you look at that, because the pelvic brace really helps to coordinate the pelvic floor, the deep abdominal muscles, and the breathing to help engage that core. All right, here's our last screen. So general exercise. So a lot of times people think, oh, I'm leaking, I need to stop exercise. I don't want to have any accidents and I'm going to stop. But it's really important for your whole overall body to exercise, okay? Does that mean that high impact aerobics needs to be your choice if you're having a lot of leakage? Maybe not. Maybe start lower impact and work into those activities that you love. But it's really important to exercise. So stay hydrated, get plenty of exercise, even if it means wearing a pad in the short term. Also, some women find that using support during activity helps them avoid urine leakage. So if you've been around me for a while, you know that I love external support. So that really just helps to lift that perineum and lift the pelvic floor muscles from below. And there are devices that you can wear that you put over your underwear, but under your outerwear. I'm wearing this so you can see what it looks like here in this picture. And then there's also some attire that has built-in perineal support. And so I really encourage you to check this out. I honestly feel like this external support should be standard after a vaginal delivery. Like after a C-section, most of the time you're getting an abdominal binder. After a vaginal delivery, I believe you need to have a little lift to the pelvic floor. Like we said, it's gone through so much, and why aren't we helping to support and rehab so that we don't have issues later in life? And then the last recommendation, sometimes people use internal support too. So this would go inside the vaginal canal. They are called pessaries. And so depending on where you are in the world, some physical therapists can fit these. In the US, we aren't fitting them at this point, but that is probably coming down the pike at some point. And then there's also pessary-like devices. So I have a picture here of tampons. There's also another device called Impressa. There's C sponges, there's Contiform devices. So there's a wide range of products out there. And I have a video that I actually review some of these, both external and internal, if you're interested. I'll link it in the captions as well. So just remember, like, there's a lot of really effective tools out there that can help you to choose when and where you want to urinate, so that increases your confidence and you can do what you love with who you love without pain, pressure, or leaks. Woo! I'm sweating. I felt like that was a talking marathon. So I'm going to go ahead and stop recording, and then I'll open it up for Q&A. So thank you for joining. And if you have any questions, just drop them in the caption box below.